Today we're going to talk about two sensory systems that are closely connected: the olfactory system, which is our sense of smell, and the gustatory system, which is our sense of taste. As a reminder, we have 8 senses: touching, hearing, seeing, smelling, tasting, vestibular, proprioception, and interoception. Today we'll focus on taste and smell. The olfactory system helps us to identify and discriminate between thousands of different odors, whether they're pleasant, unpleasant, dangerous, strong, or faint. This system is very closely connected to the limbic system, which controls emotions and memory. This is why certain smells can instantly remind us of holidays, people, or experiences. Children who are over-responsive to smells may have very strong reactions to odors. They also might refuse certain foods or avoid certain rooms, such as eating in the cafeteria because of the overwhelming smells. Some children might even decide whether they like somebody based on their smell. Children who are under-responsive, they might not notice strong smells at all. They might constantly seek out certain odors and frequently smell objects like markers, soap, or clothing. If you're under-responsive, it can create a safety concern because they might not recognize dangerous smells, like the smell of smoke or spoiled food. Here's some ways we can help kids who are over-responsive to olfactory. We want to keep the environment as fragrance-free as possible and provide some preferential seating, such as allowing them to sit near an open window or away from strong smells. This can help to reduce their discomfort. We can also teach them some coping strategies, such as covering their nose or letting an adult know when a smell feels overwhelming. We also want to increase their tolerance, but do it gradually. Something like sitting in the cafeteria for short periods. This can also help them build comfort over time. For the kids that are under-responsive, we want to increase their sense of safety awareness. We can do this through activities like scented Play-Doh or slime, playing in the grass, cooking with strong smells. This can help stimulate the olfactory system. We also can provide smelling stations with different scents. It's also very important to teach them safety skills, such as recognizing dangerous smells. And we can do this by helping them learn to compensate for poor sensory discrimination by coaching them to read expiration dates and noticing facial expressions or body language of others around them when something smells bad. The gustatory system, which is the sense of taste, it works very closely with the olfactory system. When children are over or under-responsive to oral input, it can affect eating habits and daily routines. Children who are over-responsive to taste often eat a very limited variety of foods. They may avoid certain textures, temperatures, or flavors, and often resist trying new foods. They also may dislike brushing their teeth or have a lot of anxiety related to going to the dentist. Students who are under-responsive to gustatory input, these are the kids who are going to be seeking the strong oral input, such as strong flavors, or they may chew or lick non-food items like pencils, clothing, or toys. These children might also enjoy strong toothpaste flavors, vibrating toothbrushes, or crunchy and chewy foods. You also might notice that they have increased alertness after they eat strong flavors, or they might drool a lot. So how can we help the kids who are over-responsive to gustatory input? We want to introduce textures and smells without pressure to eat, and some of this can be done through sensory play, messy food activities, food crafts that can help build their comfort with new foods. It's important to keep meal times calm and avoid forcing or pressuring children to eat new foods, since this can increase anxiety and food refusal. So when you're trying to introduce new foods, don't do this during meal times. When we are trying to introduce new foods, we want to do so in a calm environment. Since you are part of that environment, it's essential that you try to remain calm as well. Introducing new foods should be done at a consistent time each day to reduce the sensory overload. It's also helpful to start with foods that are similar to the child's preferred foods. There's something called food chaining, which can be very helpful. in which you start with a preferred food item and change one small aspect of it, one step at a time. This change could be altering something very simple, such as the spoon you presented on, or changing the texture in a small way. Children may gradually progress from simply tolerating seeing a food that's nearby them to smelling, touching, holding, and eventually tasting it. Seeing peers or adults try the same food can also increase their willingness. It's very important, however, that you consult with a professional who specializes in feeding therapy to help your child with significant food aversions. To help the children that are underresponsive, providing stronger oral input can help. This might include adding strong flavors to food, offering chewy foods such as jerky or gum if they can show that they can chew it and dispose of it properly, or providing some sensory chew tools. Oral motor activities are also helpful, such as blowing bubbles, blowing up balloons, drinking thick liquids through a straw, or games that use straws. Even ice-cold water can provide helpful sensory input. Understanding smell and taste differences can help explain many eating and behavior challenges that we see in children. With supportive strategies and patience, we can help children feel more comfortable, regulated, and successful in daily activities. Thanks for watching.